Which of the following causes of upper GI bleed is most commonly responsible for negative first endoscopic evaluation? Okay. So what are the options here? Options are Schatzki's ring, Dilephois lesion, fundal varices, and gastric antral vascular ectasias. Point number one. What is the most common cause for upper GI bleed? It is peptic ulcer, right? So that itself is an MCQ. Most common cause for upper GI bleed is peptic ulcer. Okay, but we know that that's not the only cause, right? There are various other causes. A Schatzki's ring is unlikely to present with the upper GI bleed. How Schatzki's ring would present? Mostly with recurrent food impaction, right? Recurrent food impaction. And I keep repeatedly telling this. Whenever a patient presents with recurrent food impaction, you would be thinking of two important differentials. One is Schatzki's ring. The other one is eosinophilic esophagitis, right? Okay, so this is something that I can rule out as of now. I'm left with three choices. Right? All of these can present with upper GI bleed, Dilephois lesion, fundal varices, and gastric antral vascular ectasias. Like, so okay, Gave what kind of endoscopic picture we see? We basically see something known as watermelon stomach. Okay, now we have seen so many of these images. That watermelon stomach, even we would be able to identify, right? So it's unlikely that an experienced gastroenterologist would miss that. So I'm not thinking of gastric antral vascular ectasia as a diagnosis that could be easily missed. Now between fundal varices and Dilephois lesion. Okay, fundal varices, for gastroenterologist, it takes a little bit of experience to try to maneuver and look into the fundus, right? So we know that when he is doing an endoscopy, this is how our stomach is aligned, right? So it is easy to reach through the endoscope here, look in all these directions, but he needs to maneuver this scope in this direction to look for the fundal varices. So it is a bit of a difficult maneuver to learn, but most of the gastroenterologists, by the time they are full-fledged practitioners, they will be reasonably good in identification of that. Further expertise required when you need to intervene for the fundal varices. Yeah, that definitely calls for expertise. So sometimes maneuverability may be difficult and may be missed, but not very common. Right? So fundal varices are not that commonly missed. Okay, so it is the Dilephois lesion which is most commonly missed in the initial endoscopic evaluation. So on an average, it takes around 2 to 3 endoscopic attempts before you identify the Dilephois lesion, right? So it is like a small obscure vessel from which is bleeding. So it is very difficult to appreciate, like you're seeing in this image, right? So sometimes it may be covered with the mucus plug, or it may be covered with a clot. It is tiny, so it is very often difficult to locate. So on an average, it takes around 2 to 3 endoscopic attempts before you identify the Dilephois lesion. So that's why for this question, which of the following causes of upper GI bleed is the most common reason for negative first endoscopic evaluation? Obviously, the answer is B, Dilephois lesion.